Risk factors and race. In our nursing books, you've probably noticed several diseases list race as one of the top risk factors. Many medical textbooks often identify race as a risk factor for certain diseases. However, this provides a misleading concept. In the United States, race is often directly linked with socioeconomic status. But what evidence is there to support race-related differences as a risk factor? Racism puts people of color at higher risk because they are more exposed and less protected. Once infected, people of color carry a greater burden of chronic diseases from living in underprivileged communities with poor food options, polluted air, and less healthcare opportunities available to them. Failing to isolate race from other socioeconomic and behavioral characteristics and calling them a risk factor for certain disease processes will contribute to the misdiagnosis of patients. The use of this social construct in medicine interferes with efforts to identify and remove causes of health disparities around our country. A risk factor is a fluctuating characteristic linked to the increased risk of disease or infection. Culture includes knowledge, beliefs, art, morals, law, custom, and any other capabilities and habits. Ethnicity is a complex, multidimensional construct reflecting the confluence of biological factors and geographical origins and culture. Race does not fluctuate. Race does not link any person to an increased risk of disease or infection. Race is a concept used to group people according to various factors, including their ancestral background and social identity. Race is also used to group people that share a set of identifiable features, such as their skin color or their face. Beings, regardless of race, are more than 99.99% the same at the genome level. Evidence-based medicine should be the practice of healthcare professionals. Glomerular filtration rate is one of the most common tests interpreted by race, creating a different predicted level in people of color. Race creates a blind spot in a patient's care. It allows symptoms to go unnoticed, familial history to go unchecked, and assumptions to be made. Patients of color are 2 times more likely to have their pain go untreated because they are thought to have a higher pain tolerance. The false beliefs about medical differences based on race have no scientific backing. This is a sociological and medical problem when it comes to the treatment of patients of color. Continued use of race as a risk factor allows poor medicine practices to go on. There are several myths that include beliefs that there are biological differences between races. Some of these beliefs include thinking that people with more melanin have thicker skin. Race is not a biological category. It has no reason being included in the list of risk factors. Race is a social context that causes gaps in healthcare because it is not a science. The associations of some medical conditions affecting one race more than another is more so related to the sociological effects that impact that race. Oxford Dictionary defines medicine as the science or practice of the diagnosis, treatment, and prevention of disease. There is no scientific validity to say that the color of one's skin affects their genes. Because race is a social construction, it should not be used as a medical risk factor, because it is a false biological predictor of disease processes. That is why medicine that uses race as a risk factor isn't true medicine.
It's time to stop using skin color and race in medicine. When I was in medical school, and even currently today, it is very commonplace to use race to calculate the risk of someone progressing in their cardiovascular disease or even kidney disease. We do see differences in health outcomes between different racial groups. And the presumption was that those differences are because of innate biological differences. What we do know now is through the genomic revolution that that's simply not true, that skin color or other traits that are associated with certain racial groups, that those genes are not linked to health-related genes or physiologic genes. But unfortunately, medicine hasn't caught up yet. And so we still are implementing race-based assessments, even race-based treatments.